Okay, I'm going to jump into hormones. So specifically ADK 5, ADK 10, 5,000, 10,000. This is also not theoretical. I think hopefully most people on the call understand that D3 is massively important to our health. D3 is not a hormone, or it's not a vitamin, it's a hormone. So we refer to it as a vitamin because people understand that, but our body has receptors throughout it for D3, so it's actually used as a hormone. If your patient has low testosterone or low hormones across the board, pretty much going to have low D3 as well. It goes very nicely when patients are deficient in hormones. So vitamin A, these are the benefits of it. Vitamin A does a lot for our immune system, a lot to prevent against cancer, fights inflammation. Can't have one without the other. All of these work in a good synergy. It's sort of like an orchestra presentation. A is massively important to the whole concept of what it does for the immune system in combination with the D3. These are just some quick hitter references for you in what the A and the D do. So again, they're co-partners in our immune system and bone health. They do everything from helping metabolic fitness through mitochondria to fighting infections, all the way to our innate immune system and what that can do. Vitamin D deficiency, like we teach, we like levels of D3 in the serum between about 60 and 80. If you press on your sternum or you press on the anterior tibial area, sometimes if those are painful, that could be indicative of having a low D3, but it's epidemic. I mean, a lot of you are probably checking these levels and understanding that they're quite low. So don't depend on the lab reference range that says 30 to 100 is optimal. What's optimal based upon the science and the research is 60 to 80. If a patient has cancer or has had cancer, we want to have a D3 level between 80 and 100. Why? Does D3 actually cure cancer? No, that is not the claim we're making. What we're saying is what we know. When you optimize D3, what it does is it slows down the replication of cancer cells to grow and become metastatic. So it's more of a slowing down of the growth versus fully curing cancer. It's just slowing it down. It's one of the cheapest, easiest ways you can prevent cancer. Massively important. Okay, so it's important for thyroid health, hair and nails. A lot of you may have vitamin D handouts just like I do. It goes through all the science behind heart disease and depression and bone health and all of this stuff at different levels at where you need to be. That's how we settled on 60 to 80. But these are just some of the things that can help with. This one is, I quote this all the time when talking to patients. If they've got a D level in the 20s, or specifically from this study below 20, they cannot mount or initiate an innate immune response. Okay, that's key. So if you have a low D3 as defined by less than 20 based on this article, you can't fight a virus. You can't fight a bacteria through your monocytes and macrophages. So that's another reason why people need to have their D3 up. If you want to help suppress or at least fight and upregulate your immune system, D3 is a way to do it. But let me give you a caution. If a patient is diagnosed with COVID and they have active COVID and you have them on vitamin D, be careful, because vitamin D in this particular virus can potentially worsen cytokine storm. And the way that happens, it actually activates what's called interleukin-1 beta, but the point is, when it activates that inflammatory molecule, it has been shown to worsen it. So D3, if you supplement, which you do, everybody needs to be on it, will protect the immune system. When diagnosed with COVID, I would caution and just stop it while they're fighting that virus so that we don't flip and activate that interleukin that we don't want to happen, because it could potentially worsen that. And by the way, as an aside, I meant to mention this when I kicked this off. For those in here that like to keep up with COVID in a little more granular way, from a scientific base way, you may be aware of this. If you're not, you guys need to look at something called medRxiv or BioArchive. It's actually a website. You can Google it. And that is where a lot of these researchers are going, because what those are pre-printed servers that provide preliminary reports of the research work that's going on right now in the front lines. But be very careful, because none of that stuff's peer reviewed, but you can actually see, I mean, man, there are thousands of articles coming out on specifically COVID that you can see. It's all unabated, right? So it's not been reviewed, but you can keep up with what's doing. And that's what I like to do, just to kind of look through some of this stuff. Okay, back to vitamin D. So these are some other quick hitters for you in the immune connection on what it does, from respiratory infections To flu, I've always been preaching that for a long time. D3 is massively protective against the flu virus, has been for a number of years. It's been found to be that way. Yeah, and that's all that says there. Okay, same idea. These are just more trials looking at respiratory infections and what it's done. So you have that there for your completeness. My assumption is these slides will be provided to you guys. So I don't want to read every word of every study to you, but they are here. This is a similar handout that I have in my practice that just gives different disease processes that are related to low or suboptimal vitamin D. So there's several things here as you go down the list. All of this is the stuff that we see. So again, why do we need vitamin D? Pregnancy, all the way up to seasoned patients, which I call elderly. Pregnant women, you know, the key with pregnancy, just so you know, they're not on vitamin A or vitamin K. So with pregnancy, the disclaimer needs to be on this slide. They need D3 only, right? So take them off the A and the K. They need to be on monotherapy with D3, but it helps to support her immune system, helps to support the developing baby's immune system, all the way up through kids. My kids are 5, 5, and 7. They get their D drops every morning and some fat, and they don't tend to get sick, so that's good. And then again, all the way into adults and seasoned patients. And these are just kind of a good summary of what everything that vitamin D can do, from immune balance to metabolic health to healthy skin to supporting mood and cardiovascular health, bones, all of this stuff. So a lot of times patients will ask, and sometimes you will ask, you know, can I get this from the sun? And yes and no. So you can get some D3 from the sun. This is a schematic that basically shows you what you'd have to be wearing or not wearing and how long you'd have to be out in the sun to potentially get an adequate D amount. And the conclusion is it's very difficult to do that. Here's a quote from Dave Asprey. I don't know if any of you follow that. I'm a podcast junkie, and I listen to a lot of these biohacking, longevity type people. He's not a physician, but Dave's pretty well known in the space, and he's got a lot of really amazing clinicians that go onto his show. And anyways, this was a quote that he had on vitamin D and what it does. It is the ultimate biohack, and essentially what that means is it acts on all sorts of genes, and it helps these genes express themselves in a way that helps us, from immune function to inflammation. It's just a super important one. Its role in cancer, these were just some RCTs, 75,000 participants. The conclusion was it reduced the risk of cancer death by 16%. Again, it just slows down the replication of these cells. There's a quote from Mark Hyman, one of my mentors down there. Can we give monotherapy with D3 in pregnant women? Yes, but if you're not pregnant, no. So this was just one article that found vitamin D by itself didn't do much for bone health. So that's why we talk about ADK. Okay, so the power of K2. What is K2? In the body, I usually ask this in training, but where in the body do we make it? We make it in the gut. So we do make our own K2, just so we're aware of that. But a lot of us have dysfunctional guts, which I'll get to here in a second. So what does K2 do? Well, the idea is that, to keep it simple, K2 removes calcium from the artery and shoves it into the bone. That's what it does. How does it do that? It does it through osteocalcin. Okay, that's a necessary protein that helps with this. It also does it through matrix GLA protein 2. I won't get into that, but those are the two mechanisms by which it actually removes it from the blood, shoves it into the bone. It's important to the listener to know this as well. D3 is a fat-soluble vitamin. A, D, E, and K are fat-soluble. So please have your patient consume their D with fat. No, that doesn't mean with fish oil. They need their fish oil. That's not enough fat. They need actual food fat. Walnuts, almonds, avocados, oils. They need to eat the fat, take the D. It works fantastically. Second point I want to make about vitamin D along with K2. There's a big misnomer in medicine. It's been this way for years. Calcium, calcium, calcium. As people age, they need to take calcium. Nothing could be further from the truth. As you age, your D3 drops. So when you start supplementing with D3, if you can get a level up above 60 in the serum of D3, I assure you, the patient's ability to absorb calcium from their diet, green leafy vegetables specifically, will go through the roof. So if they're taking their Oscal or some other calcium supplement, they're going to find that they're hypercalcemic. The next time you look at their ionized calcium or their intact calcium or just their serum calcium, you're going to see that their calcium's too high. So there were some papers that came out a few years ago that showed if you take D3 and you don't have K2, number one, that you will run the risk of calcifying those arteries. but a lot of that is because people are supplementing with calcium. So again, you will absorb the calcium from your food exponentially if you get your D3 up. As you take it with fat, you won't need calcium. You'll need D3, and osteoporosis and penia will be an absolute thing of the past, especially when you combine it with the estrogen and testosterone. Okay, I get tangential, I apologize. But K2, made in the gut, massively important, this whole idea. The Rotterdam study showed the higher you went with your K2, the more you reduced your arterial calcification. So again, calcifications is a big, big problem. So you want to reduce that with K2. How do they complement each other? Well, vitamin D comes in, and essentially, when you eat calcium, it is absorbed through the gut, goes into the blood, and then vitamin K takes the calcium away from the arteries or the soft tissues and directs it into the bone. That's physiologically how that works. And just another sort of paper as to why we do it all together. It helps to influence everything from insulin resistance to autoimmune conditions, mitochondrial function, inflammation, all of that. And again, it's through matrix GLA2, protein 2, and then osteocalcin. And here's your summary slide. These are your labels over here for ADK5, ADK10, and what each of them will do. So DIM SGS Plus, you know now when to use that. ADK5 and ADK10, absolutely everybody needs to be on this stuff. This is protecting their immune system, as is helping them detox, as is the hormones, as is the thyroid. So now you have these, hopefully, for your armamentarium. You've got to be very confident with this stuff. Please do not let your patients get D3 from over the counter, please, because it's not going to contain K2, and if it does, it's not going to contain the right K. It's going to be K1, it's going to be some other form, and it's not going to be protective to them, and they will get hypercalcemic eventually.